start off the presentation with like a little video of just some sports injuries.
The graphics are disturbing. Okay.
Oh, no.
Thanks.
They're not bad, I promise, they're not bad.
Okay.
Wait,
Want this on?
That one was his ankle. In case you didn't catch it.
Oh, then you've got a broken leg there. Oh, dear.
So we're gonna cut on the video because there's 30 seconds max of video in the presentation. Okay.
Okay, so these are the different types of sports injuries that we're going to be talking about. We're going to be talking about knee injuries, Achilles tendon injuries, pain along the shin bones, dislocation, and fractures.
So first one, concussions. Concussion is a traumatic brain injury that affects brain function. It can be caused by a blow to the head usually, or violent shaking of the head or the upper body. Some of the symptoms are headaches, confusion, or the feeling of being in a fog, amnesia, dizziness, ringing in the ears, nausea, vomiting, slurred speech. Concussions usually last, depending on how severe. Like an average concussion is about a week out from any contact. And then it can last almost up to 2.5 weeks. You can also, concussions aren't felt right away. Some of them, it takes about 3 to 4 days before you actually feel the symptoms of a concussion. More severe concussions, a person will wake up and start throwing up right away and or spitting up blood. Overall, concussions are in almost all contact sports, and they can have, when you have too many of them, they can cause long-term effects, such as getting CTE and memory loss.
The hip flexor strain is the largest bone in the body, so the femur, and you can see it in the hips and joints of the body. And this is mostly involved with running and playing soccer. Is when you can see this injury occur. And this strain is caused mostly by excessive running and up and down the ligaments. So if you ever get it, it's past the femur or somewhere past every running, facing each of the broken joints.
So here we have an Achilles tendon. This slide would have been Ariel's, but unfortunately she couldn't make it. So the Achilles tendon is located in the back of your ankle. It connects your calf muscle to your heel bone. And this is the largest tendon you'd find on a body. And this could be any sport. It could actually happen from running to basketball, any sport you see. And that's because the Achilles tendon is the largest tendon as well. It is vital to your walking, to just daily basis moving. So there's two types of injuries from this. It can go from small tears to insertional Achilles tendons, which is like where the tendon meets the heel, and it could be damaged that tears it, and it just makes it difficult to your movement of walking.
Okay, so this one was my slide. So I did strains and sprains. So a strain or a sprain is a torn ligament, and then a strain is like a stretch or like a torn muscle. So ligaments are like tissues that connect a bone to the joint. And the symptoms are the same for both, which is like pain, swelling, redness, bruising. The most common that sprains happen in is the ankle, and that can happen in most every sport. And then strains are more like your upper hammy, like your bigger muscles. That's where those mostly happen, and those happen in a lot more like physical sports like basketball, football, soccer. And the treatment for both of those is pretty much the same, just ice, rest, physical therapy in some cases. So they're pretty much the same.
So here we have a mallet finger. This lovely photo right here is actually of my finger that I broke in basketball season, and it's actually known for basketball or baseball finger. This it occurs. It's caused by the impact of an object on the outermost joint. So as you see here, the tendon could tear, making it become like at a 90-degree angle. And for me, I had to have a splint. So for at least 3 months, it was terrible. And so the tendon is connected to the muscle, and sometimes due to the impact, it is separated. And there's 3 types of injuries. It can go from just the rupture of it, meaning like just the tendon broke off. It can go from the tendon rupturing and a small fracture, or it can go to a complete fracture where at that point you have to get surgery. And what they do is they pin it down, and I'm not sure if they add metal, but basically you have to get surgery on your finger, on your smaller finger. But that's an x-ray right there, as you can see, and that's how my finger looked, and it looks better now. Also, for the fracture, it would be called a mallet fracture instead of a mallet finger, but that is what it's also known as. So, there we go.
And then we just have our appendix.
Okay, good. Thank you. Yeah.